This morning. We submitted chin lag and a chipped front pressure dressing. Bleeding pretty good on arrival.
How you feeling, Kylie?
Tired?
We've been here to all this. No worries. We got you. Next.
Hey, nice of you to join us. Candace O'Grady, 82. Intractable vomiting.
What's the good word, Crash? You saved that ventriloquist dummy?
Yeah.
Really?
No.
Wait, tell me you're not actually charging about losing a mannequin. And Barbie?
Okay.
What's your take on the new attending? Not too soon to tell. You? She's already bugging me about being behind on my charting. Now I know why everyone says being a second-year resident sucks, because it does.
Nice.
Hey, Dr. Shaughnessy. Dr. Trinity Santos. Well, it's me, but I'm an R2 now, and thinking of double boarding in surgery and emergency medicine, which I know would sound ridiculously ambitious if I didn't have the talent to back it up.
And the required attitude.
Next Tuesday's your birthday? No? Yes? Your 21st birthday?
Please don't say anything. Okay, I get a little anxious
Dr.
about...
Santos, little girl with a chin lag's getting to a gown. Don't want anyone to know what.
Nothing. Have a good day. You too. Maligayang kaarawan.
Oh.
Huh? What's up with you today, Mel? Lynn Galia?
What makes you think there's something up with me?
You're moping around here all day like somebody gunned down your favorite K-pop band.
I don't really have a favorite K-pop band. Not that I don't like the genre.
Hey, forget K-pop. What's going on with you? You usually ride in here on your unicorn tossing wildflowers.
Unicorn?
Never mind. Is everything okay with your sister?
Oh, yeah, she's great. It's just this... Oh, wait.
Spill, girl.
Well, today is the deposition.
That's it? Every emergency medicine doc gets sued sooner or later. Seriously, don't sweat it. I mean, you're still a resident. We're protected by the hospital. You could cut somebody's head off and get away with it. But, you know, like, don't. You won't want to become known as the one who put Mel in malpractice.
Hey, Santos. Our little girl Kylie has been in the West Penn Emergency Department a couple times.
All right, lungs sound great. Can you lean forward for me? Did you hit your back when you fell down the stairs?
No.
Okay, there's a pretty good bruise here.
I got knocked down in soccer.
Oh, no, you broke your wrist last year too, huh?
Fell with my skateboard. Got a purple cast.
Cool color.
And you were treated at West Penn? Is that your closest hospital?
I lived in Garfield before the divorce.
And what about these?
Soccer.
Do you wear shin guards?
My dad ordered them.
What does your dad do for work?
He draws buildings, but he's not an architect.
Kylie, there are some questions that we ask every kid who comes in with an injury.
Like what?
Like, sometimes the people that you live with can get so mad that they hit you or hurt you, maybe without even meaning to. Does that ever happen?
No, not to me.
Or sometimes kids can get punished for doing something wrong with maybe a spanking or a belt.
I get timeouts.
How about at school, Kylie? You know, is anybody being, mean or bullying you?
No, I have lots of friends.
Nine-year-old Kylie Connors took a tumble running up the stairs this morning, chin lac and fractured tooth. Supposedly the dad had to leave with some new.
Are you concerned about non-accidental trauma?
Or worse, her urine sample shows gross hematuria, which could be renal injury or vaginal bleeding from trauma. Labs, ultrasound, social work consult, then decide if this is reportable.
Uncooperative?
No, not really. Apparently she's only been going out with the little girl.
He gets here. You talked to the trauma counselor this week?
I'm going to. Promise.
Okay. Okay, good.
Medics are all.
Her gut.
Yeah, it's this thing that AI will never have.
I don't want to think about what my gut is saying right now.
Come find me when you know more.
Us, if you don't mind.
I don't mind us. Come find us when you know more. Do you want to jump on this trauma?
I've got my hands full.
She's not working today. It's, I forget. I'll find out and get him down here. What else you need?
How about a double espresso, martini?
I like the way you think. Hey, Trudy, it's Dana.
Well, just tell her that her efforts would be better suited endorsing someone like myself. If you're seriously thinking of a double residency, let me save you the trouble. You can't do it. Why? Just because you couldn't do it? Honestly, yes. Because you're a genius. Yes. What's the square root of 841? I'm not a human calculator. I have a nun with conjunctivitis. Her swab is showing gram-negative intracellular diplococci.
Gonorrhea?
Come to Jesus.
Well, a lab must have made a mistake.
Maybe it's an immaculate infection.
We'll call the lab soup. Clear this up. Tread carefully, Missy.
There's a nun with gonorrhea in her eye. Seriously, you guys are gonna take this away from me? Disappointed in you two. 29.
What?
Square root of 841.
How we doing?
What do you like to do for fun?
I love horseback riding.
Does your dad take you?
Yep. Sometimes he even rides, but most of the time.
Get in your body when we do it. Okay.
Tough little girl.
Yeah, well, little girls can be just as tough as little boys, even tougher.
Yes. I just hope it's not because she's become accustomed to pain. At the very least, she's going to need a visual exam of external genitalia to look for signs of trauma. I can have Dr. Ellis shoot me.
No, she's my patient. I can do it. What he is your competition. He's a gunner. Yeah, right. He's not my competition. He's from out of state for a 4-week sub internship. You don't think he's angling for an emergency residency spot here next year? I mean, even if he was, what? He couldn't possibly compete with your gigantic brain? I'd step it up if I were you. All right, I guess it's just us. What did the girlfriend have to say?
Well, Gina seems a little confused and on edge by this, but I'm not suspicious about abuse on her part.
What about Kylie's father?
Well, I'm a social worker, not a mind reader. I need to speak with him.
Yeah, he's supposed to come in. If he doesn't, looks pretty guilty.
Let's not jump to any conclusions just yet.
I'm not jumping. I'm just saying if this dude doesn't show up, hell, I'll go find him myself. Every day? If we're lucky. That's what she said.
She could just be a little shy or scared of being in here.
Or she's being abused.
That too. We'll find out more when Dad shows up.
No, if he shows up. Mr. Connors, I'm Dr. Santos. I'm treating Kylie.
She okay? Can I see her? My girlfriend Gina says she got a cut on her chin.
Yeah, I can take you to her. She has a small laceration on her chin, but it was easily repaired with medical superglue, so no stitches necessary.
Okay.
She chipped her tooth, but it's a baby tooth, so it won't need dental work.
All right, well, that's a relief.
Has Kylie had any previous injuries?
Yeah, she broke her wrist last year. She was skateboarding.
Dana, if you could get Dylan to come to North 1 and Ahmad.
You bet.
Okay, I got it now. 1, 2, 3.
Daddy, you came.
Oh, baby, what's going
As
on?
I was saying, Mr. Connors, the laceration's pretty minor.
On the stairs?
It was an accident.
Perhaps we can step out.
Accident that wouldn't have happened if you weren't running up the stairs. Do
We
you
weren't
understand what I'm
running
saying?
up the
This is the last
stairs.
thing that I need right now is her mother finding out that she got hurt when she's with you.
It was an accident. And before you get all high and mighty, I've got questions of my own.
Like what?
Hey, Mr. Connors, I'm sorry. I meant to be here when you arrived. I'm Dylan Easton. I'm social services.
We have insurance, thank you.
Perhaps we can step outside and chat for a second. I can fill you in where we...
Bruising on Kylie's body, some old, some new, on her back and legs. Any idea how she got those?
Yeah, soccer. She plays for a club team. They're, little girls, but they play like they're in the Hunger Games.
Well, I understand that you and Kylie do a fair amount of roughhousing.
What? I'm sorry, are you fucking kidding me? Where are you going with this? Are you saying that I hurt my daughter?
Mr. Connors,
Oh,
nobody's
no.
saying-
To know we're all her bruises are
Who
from.
the fuck are you to talk about me and my daughter?
Who the fuck
Yeah,
am
that
I?
fucking step.
Hey,
I
that's
did.
enough. You need to
Whoa,
calm
is
down.
that a
Everybody.
threat?
What does that mean?
It's not what we thought. It's probably ITP.
What the hell is ITP?
Something we can treat.
So your little girl was ITP?
Go figure. Nothing like a zebra to kickstart your morning.
Well, it's better than the alternative.
True. Used to be called idiopathic thrombocytopenic purpura. Know what idiopathic means?
That we don't know the exact cause.
Means the patient is pathetic and the doctor is an idiot. Platelets are these tiny things in the blood that help it clot. And thrombocytopenia is fancy for low platelets, which explains why you're feeling, which reduces the destruction of the platelets in the spleen.
Can I go home?
You're gonna have to stay in the hospital for about 3 days to make sure that the treatment is working.
Okay. Okay, so when can she get a room in the hospital?
That is an excellent question. I'm going to see if I can make that happen sooner rather than later, but it might take a while.
Thank you, Benny.
All right, I'll see you when you get here.
See you soon, baby. I love you.
Bye, Mom. Love you too.
You ever heard of ITP? I never did.
You are finished. We're finished.
Well, happy.
It's my cross to bear. It can't be as
I
bad.
lived at home in years. I kind of miss it.
I can tell. You've been spending a lot of time on that farm. Farm? Remember the burned farmer who came in last year? Propane tank exploded. He died in the ICU.
Yeah, that was sad.
Well, this guy has been playing house with his widow and their baby.
Oh, that's messy.
No, a friend. She's just a friend.
Sure, just a friend with farm benefits.
What are...
Dr. Santos, making progress on your charting, I hope.
Getting there.
Deficient charts leave a gap for the providers who give continuity of care and delays hospital billing.
Oh, I'd hate to delay billing. I'm on it, boss.
Good. You wouldn't want to repeat your R2 year again because of this.
So, Dr. Al-Hashimi,
Yes?
do we like her?
She seems pretty cool so far.
Can you not?
Yeah, sorry.
Hot off the press.
Never flirted with you?
Sure, why?
Well, there's this guy this morning. He turned out to be a criminal. But, yeah, it was a nice distraction from the deposition.
Still worried about that.
Yep. Yeah, Ken. Hi, Miss Ronson. Felicia, please. Felicia. I'm Dr. King. This is my colleague, Dr. Santos. What brings you in today? Do you have anything to ask, Dr. Santos? What? Do you have any questions to ask our patient?
No, I'm good.
Okay, what'd you hear?
Maybe some crackles at the right base.
Okay, well, we're gonna need...
Do you ever drink a lot of alcohol? Maybe so much that you pass out?
No, I'm not a big drinker.
Have you had the stomach flu recently? Food poisoning?
No and no.
Do you mind if we take a look inside your mouth? And open wide.
What?
The enamel on the back of your teeth is worn away.
What does that mean? I stopped before. We're mourning, we just eat. But then I got to college and it was all about how you looked.
That's a lot of pressure.
I didn't need to purge as much.
You're doing long-term damage to your body. And it doesn't just go away on its own. It's okay to ask for help.
We can set you up with our eating disorder program upstairs.
That was a good catch.
Black women tend to go underdiagnosed when it comes to eating disorders.
Really?
Yeah, unfortunately. You know, I thought I had an intern year.
Oh, yeah, yeah, overseeing the med students, the interns, having no time to do my own charts.
Just wait until you get into medical, surgical, and cardiac ICU. I stands for intense.
Somehow that seems like an understatement.
It does help you grow your clinical skills, you know, caring for the sickest patients.
Tell that to these charts. Oh,
No, usually doesn't. I think most clinicians would have missed it.
but you didn't.
Guess I got lucky.
Whatever, Fuckleberry.
Okay, I'm sorry. Did I do something to bother you?
Nope.